So how exactly do different generations of dentists relate to each other nowadays? How are their perspectives similar and different? We asked an established dentist, an endodontist, and a dental student from Midwestern University to sit down and discuss dentistry, life, and whatever else was on their minds.
All right, Dr. Roda, are you ready?
I am.
All right. What are you interested in outside of dentistry that would surprise people?
Well, for the people that know me, it's probably no surprise, but for people that don't know me, I really, really, really love science fiction.
Okay.
I mean, I'm like right into it, and it's funny because then everyone will say, when they hear that, they'll say, "Oh, what about this? What about that?" And I'll say, "Well, I never saw it because it was trash." I only like really good science fiction. The other thing is that people are surprised about is I really like heavy metal music, and I do. And
all right.
And
what band?
Well, some of the newer heavy metal bands, they just escape me because there's a lot of screaming and animal grunts and things. I don't like that. Yeah. I like the older kind of heavy metal, like Kiss and some of that stuff.
Okay,
the ones that
so
have
like
a
the
show.
classic
But the band I'm obsessed with right now is called Baby Metal, and it's a band from Japan, and they've been out for 10 years. They got like 50 songs, and it's this really strange thing because it's these three little girls who they started off when they were very young. They're in their 20s now, but they were like young teenagers. And they've got this shredding heavy metal music behind them that's just amazing. But they sing and they dance, which is amazing. And the themes of their music are about moving forward and getting past barriers and don't bully people and, female empowerment. And it's just a really good, their songs just make you feel good. And it's got me right back into heavy metal again. So they're great. And someday I'm going to show you. Someday I'll show you one of their videos.
I want to see this.
It's very cool.
I know. I want to see their song and their dance and everything too. They sound awesome.
They are kind of cool. I like them. So.
Well, cool. So it's not just dentistry. You have other interests.
Oh gosh, yeah, yeah. I mean, I love dentistry. I'm kind of a junkie on dentistry. Dental nerd, whatever you want to call it, but there are other things besides dentistry.
Okay, good.
What are you interested outside of dentistry? Because I've heard some rumors, and I'd really like to know if it's true.
Yep, I'm a wild one, actually. Some people really love this, and some people get scared for me. But anyway, what I like to do is I track motorcycles. That's my thing. I love speed. I love to go fast. I love the thrill. So I have several sport bikes, and I like to take them to the track.
So are these what they call crotch rockets?
Yes.
Yes, okay.
Yes,
so these are fast, powerful, big bikes, and you go on a track?
Yes. I go on a track. I race people, which is super fun.
Isn't it super dangerous?
I mean, if you crash, right?
So that's the key. Let's have a 100% success rate and not crash.
Exactly.
Yeah.
So you got to stay up on two. So I love it. Getting really close to the asphalt. Drag a knee is what we do.
I know. I've seen people doing that with the knees like this far, and they're going 100 miles an hour.
Yep.
Oh my God.
That's me. I have a purple motorcycle, which I love. Got to throw in a little girly flair to it.
Yeah, well, sure.
And be badass as well. So that's what I
amazing.
do. Yeah, outside of
That's
dentistry.
amazing. That's really cool.
How have you changed in almost 40 years of practice? First of all, 40 years.
Thanks for bringing that
I
up.
know.
Thanks for bringing that up.
That's hilarious. So you were really young when you were a dentist, obviously.
Well,
you're like
I graduated dental school.
now.
I graduated dental school at 24.
Okay.
So I don't know if that.
Yeah, that's young.
Is that young?
Absolutely.
Okay, so I was young, and there's an old expression that's kind of vulgar, and I'm pretty sure it's going to get edited out. But we used to say that when you're a young man, you were full of piss and vinegar.
Okay.
And I thought I was going to save the world. I thought there was no tooth that couldn't be saved. I thought there was no mouth that couldn't be saved, and I was just going to fix the world. And there was nothing dental disease could do that I couldn't fix. And I've learned very quickly, and dentistry humbled me a lot. But it's also the nature of the human mouth has humbled me a lot. When I was a young dentist, I would have said that the definition of dentistry is the correction, the elimination of disease, the correction of dental malformations, and getting people to optimal oral health. And now I have a different definition of dentistry. My definition of dentistry right now is that it's an attempt to slow down the natural degeneration of the human mouth so that upon death, a human has a relatively full complement of healthy natural teeth. Number one, human mouths naturally degenerate.
Yeah.
and they take our dental work with it. And that's the other thing. The first time I saw any kind of a filling or crown of mine that came back and it had re-decay and it needed to be redone was devastating for me. How could this happen? I did a perfect job. Well, the thing I forgot about was there's another person involved in this, and that's the patient. There's other factors involved in that, which is what's the nature of the bacteria in their mouth and the oral fluids that they're taking and all this kind of stuff. And I started to develop this different view, and I see a much bigger picture than I did before. We're not repair people for the mouth. We're trying to keep people on the track of slowing down the natural disease that's there and the natural forces that destroy our things. If you took a $60,000 Mercedes and you put it into an environment where it's thermocycled from the temperature of hot coffee to the temperature of cold ice cream, sometimes on a second-by-second basis. You're out at a nice restaurant and you eat your ice cream dessert and then take a sip of hot coffee. The thermocycling that's going on in there is enough to destroy anything in enough time. But then add to that it's bathed in a solution of acids and enzymes and corrosive fluids and all this kind of stuff. And just as a kicker, let's bang it with a sledgehammer at 600 pounds pressure per square inch 1,200 times a day. And you see what all of our dental work has to live up to. That $60,000 Mercedes would be destroyed within a minute, and our stuff lasts for years. And I am so proud of our profession and our ability to be able to handle these things. I guess that the biggest change I have in my attitude about dentistry is what we're expected to do. And what we're expected to do is to slow down a natural process that if we weren't there, people would be toothless by the age of 40, and we do an amazing job to keep their teeth that long.